Hey, welcome to the Dr. G Show. It's been quite a while now. I think we're live. Now we're live. Okay, welcome to the Dr. G Show. Um, it has been a while now. This is episode 188. So this marks 5 years, I think, that we've been doing the Dr. G Show. So that's pretty good. And it's 2021, so hopefully we have different year this year. So I appreciate you guys kind of watching, and as you guys join us, if you have questions or comments, please post those. I'll try to keep up with them. I see that since the last time I've done this, we have a new format on Facebook Live, so I think it makes it a little bit easier for us. So tonight we're going to talk about the cholesterol myth, and so we're going to jump over the most obvious topic, but we'll do a COVID topic maybe next and talk about the new vaccine, new variants, all those kind of things. I know we had a really good showing last time for all the people that joined us for the COVID one, but we'll keep it interesting. So tonight's topic, we want to talk about not only about the cholesterol myth, but we want to talk about really what are the actual causes of heart disease, and then also what do we know that reverses those. So it's a very straightforward process when it comes to heart disease, and I think many of us kind of feel like we're in the kind of our loop of all this, of like, could it be this, could it be that, could it be this, and we just don't know. So we're going to try to clarify a lot of that for you today, and then we'll talk about statins and then the mechanism of that, and then all the processes that it messes up and why it's one of the most dangerous drugs to take long term, for sure. And if you guys didn't know, so I think when COVID happened, we stopped doing the Dr. G Show for a little bit. We did some shows with Marty Spence with Songbird Juice Company, because we're like, is this the end of the world? What are we going to do? So we had some cute little podcasts that we did with Marty. And then we did a few Dr. G shows with Suzanne to try to kind of get back in the groove of it. And then all of a sudden, the mic stopped working on Facebook Live, and you guys couldn't hear any of the shows. And we had Dr. Kristen Lloyd on, and we're talking about reversing diabetes. But come to find out, that's an actual glitch within Facebook Live for iPhones. So we're doing this on the computer this time, and I got a better camera and better setup, so I think we're good. So I've been trying to figure this out. It's been driving me crazy, but now we're back on track with the Dr. G Show. So as you guys know, last year during COVID, I came out with the Cooking After Dark with Dr. G Show, and that stopped because of COVID. So then we created the Dr. G Cooking After Dark with Dr. G cookbook, Gourmet Tacos, which is available on Amazon, which is super cool. So it's published on there. You can get it hard copy and even a Kindle version. And then Jamie Farley and me are coming up with a new cookbook this year. And so we actually did our first one, which was black rice with curry. So it was so delicious. Curry is not always the most pretty thing, but you add some peppers and you add some cilantro, and it kind of makes the dish look a little more lively. So we're going to have that cookbook coming out somewhere, hopefully by summer. We should have all the dishes done for that. So let's start today. If you guys have questions, feel free to post it. I think it shows on the screen now. So it's good to be back. All right, so many of you guys kind of know who I am. I practice functional lifestyle medicine. I've been doing this for like 17 years. I've been a lecturer all around the country and all over the world, and last year I had the opportunity to be the keynote speaker at the International Symposium of Health and Wellness in Bangkok, Thailand, and then I spoke and attended the conference, and I island jumped for a little bit on island Phuket, so that was pretty awesome. But otherwise, I've done a lot of postdoc education at Harvard Medical School, Yale, Melbourne, all these universities to try to figure out how we really reverse disease. And Harvard has some of the best programs for lifestyle medicine. And so even though I practice like, functional medicine, clinical nutrition, really it's all kind of lifestyle medicine. And the key to like functional lifestyle medicine is to know how the body works, know what we do to mess it up, teach people stop messing it up. It's the cheapest, easiest fix for the most complex problems there is out there. And so usually I'm the last resort people go to because they don't want to change anything. But when no medications work, they're faced with surgery and no other options or chemo, then they come see Dr. G, and then we teach them how to get the body back. So the stuff tonight, it's a really important focus because so many people, 1 out of 2 is at risk of heart disease and stroke, and we have children having heart disease start. We now have like teenagers having heart attacks and strokes, and then of course my generation, Generation X, is not expected to outlive our parents, so we're supposed to lose up to 28 years off our lifespan. So, we are just dying at a younger age now, which is incredible, and heart disease is a big chunk of that. For all the people that are type 2 diabetics, that's 1 out of every 2 Americans is either full-blown type 2 diabetic or will be within 3 to 5 years. They don't die of diabetes. They die of the cardiovascular disease that's caused by this, the loss of the kidneys, all these horrific kind of like consequences. So heart disease is a pretty wide topic through pretty much all the age groups now, which it hasn't always been like that. In fact, women at a certain age are more likely to have heart attacks than men for the first time in history. So, hasn't always been like that. And so we're scrambling to try to figure out what the heck's going on and really kind of like financially, how can we create things to make lots of money trying to solve this problem, which then becomes the problem. So the fix is already there because heart disease, even when it was #1 killer 100 years ago, it was pretty low. It was like this on the map, and then now we kill 18 times more people with heart disease. So that sudden epidemic in 1910 goes like this to 1990 and then 2000. So we created a sudden epidemic in 1910 of heart disease, and then we come up with all these convoluted reasons why we think people have heart disease in this sudden epidemic, and so they blamed eggs back in the beginning, and they said, oh, it must be eggs, we're all dying because of eggs. But we've always eaten eggs. Cultures that eat eggs on a regular basis don't have the sudden epidemic of heart disease either. In fact, they have lower risk of heart attack and stroke, so that doesn't pan out. And in fact, the first presidential, committee on determining this, they said that, of course, eggs didn't cause heart disease. And then they got fired. They got a new panel, and the new panel said, oh, it's definitely eggs. So as you know, if you're old enough or your parents, there's this whole time where it was like eggs are going to kill us all. And then they came out and said, well, maybe just yolks. And then eventually they finally were like, okay, it's not eggs. 70s is when we started saying like, well, it's probably meat. And meat does have a problem with causing cardiovascular disease, but it's not meat. Because every animal eats meat, or not every animal, but almost all animals, they eat meat and they don't have heart disease. Almost all humans eat meat, but in different countries, they have dramatically less heart disease. So it can't be the meat. So it's usually in America what we change, what we do to cause the problem. So if you look at something like inflammatory meat, so if you feed a cow corn, you eat that cow. Chicken, fish, it's all the same. If you feed it highly inflammatory corn, it's high omega-6. And then that makes a series of prostaglandins through an enzymatic process called COX-2. And then there's 4 major outcomes to that. The #1 outcome to eating inflammatory chicken, fish, or beef is you get chronic pain and inflammation. Cow eats inflammation, you eat the cow, you get its inflammation. So chronic pain, chronic inflammatory diseases, which range from arthritis all the way to cancer. Then the second big thing is you get hypertension or high blood pressure, which is one of the big killers for heart disease and stroke. The third one is you get arrhythmias, which then are irregular heartbeats for heart attack and stroke. And then the last one is you get more clots, which means more heart attack and more stroke. So out of those 4 consequences to eating an inflammatory American kind of diet, is 3 out of 4 of those killers are for the heart and for the brain. So heart attack and stroke, which are the same things, just in different organs. Stroke is up here, heart attack's here, same exact thing. So then we figured out it's not meat. So it is inflammatory meat, but that's inflammation, right? And we'll get to that a little bit later. So then they were just saying, well, it's just cholesterol. We just, we can't figure this out. It's too complicated. So it must be cholesterol. And if we believe that, that means that God created cholesterol to kill mostly Americans, but only in the last 100 years because he hates our freedom. Is that right? That doesn't sound right. So if you have cholesterol in Europe, you have 70% less risk of having a heart attack or stroke. But you move to America, too much freedom, cholesterol gets angry and starts killing us. So that's lunacy. Of course, that's not correct. But that's the direction we're at right now. So now we look back at eggs and go, that's ridiculous. But at the time of eggs, they were dead serious. Then it was meat. Then it was the next thing. It's always the same, right? Now, when you look at cholesterol, is it really cholesterol? Because if we have a sudden epidemic, then we must be eating an exogenous amount of cholesterol all of a sudden, or suddenly cholesterol just stopped being our best friends and friended us on Facebook, and now they're talking smack behind our back and causing this inflammatory reaction, which is ridiculous. So, becomes a mess. Now, 1910 is when we had the sudden epidemic. Guess what changed in 1910? And so, by 1910, we started eating 10 pounds of sugar a year in America. 10 pounds of added sugars, not fruits, added sugar to our diet. And with that, that causes something called advanced glycation end products, which literally damages the fine arterioles of our brain and our heart, which causes heart attack and stroke. So as we went from 0 pounds to 10 pounds, we see an incline. From 10 pounds to 140 pounds of added sugar to our diet, we see a sudden dramatic increase of cardiovascular damage from things like sugar, right? So we know sugar is the only thing that actually makes the most sense and directly causes it and directly was increased, so that makes perfect sense. But who the hell is going to go against sugar? Sugar is more addicting than crack cocaine, and the more sugar you eat, the more you downregulate your dopamine in your brain of your own production. So sugar, just like a drug, will raise dopamine. I feel better when I eat sugar. Your body produces less. Now it takes more sugar to get back up to where you were, and more and more and more, and then you become a sugarholic or a sugar addict, and basically you're just a drug addict that can legally buy sugar, right? Nobody cares about that. So now soda has 16 teaspoons of sugar. So if you think about that, here's your can, 12-ounce can, 1, 2, 3, 4, 5, 6, 7, 8, 9, all the way to 16, just for a can, right? 16 teaspoons of sugar, all of which are going to damage the arteries in your blood vessels. So you lose your eyes, lose your kidneys, lose your heart, lose your brain. So, fingers too. So, heart disease is a big problem, but we need to address it in the real way. So, sugar is a real way, and we'll talk about the real cause of heart disease in just a minute. So, let's go back to our cholesterol. So, they're still stuck on this cholesterol in the medical standpoint. Some are going away from it, and some aren't. But at some point, it's going to become the cholesterol myth, and we're going to look back at it like we did eggs and go, what the hell are we thinking? But are we harming people in the treatment by lowering cholesterol? So, most people, and I would probably include some doctors in this, do not know that cholesterol is what makes vitamin D. If you lower your cholesterol, you lower your vitamin D. And then guess what? You have a pandemic of low vitamin D. And then now we got to say, well, let's just give people vitamin D. So we'll make it synthetically from petroleum. That ends up harming people. So, okay, we'll come up with a safer one. So now we'll take lanolin from sheep's wool and we'll make some vitamin D out of that. But high dose vitamin D actually brings calcium to the arteries, which then kind of contributes to heart disease. So then they were like, okay, well, wait, we can do this, but then we got to add in vitamin K2. And then it has to be the specific types of K2 and the specific kind of ranges, all because we lowered the cholesterol that lowered vitamin D, right? So when that sun hits your skin, cholesterol in your skin actually converts to vitamin D, or 7-ketocholcalciferol, which then goes to your liver and becomes 125-OH, or becomes 25-OH. Then goes to your kidneys and creates 125-OH, and that's your active vitamin D. So what about progesterone? Progesterone, which is your happy hormone, is made from cholesterol. Now, progesterone converts into cortisol, which is your stress hormone. So you're going to pick happiness or you're going to pick stress? Well, we're the most anxious and depressed country on the planet. So we're going to exhaust progesterone as cortisol, getting rid of our fertility and our happiness. And then we're going to prevent it from being made or compensating by lowering cholesterol. So cholesterol cannot become pregnenolone. It cannot become progesterone. Then we end up not happy, but super stressed. So it sabotages our happiness. DHEA, which is anti-aging hormone, it's an epiandrogen. It is the largest amount of hormone in your body, and it's made from, guess what? Cholesterol. So if you lower cholesterol, you should lower your DHEA, which then means you age faster. So now you're going to age faster, look older than you are, and you're taking medication to cause that, which doesn't actually lower your risk of heart attack. Testosterone, that's a big one. Testosterone is made from cholesterol, and testosterone is your sex drive for men and women, and it's your get up and go. It's your pep. It's your like drive, right? So now I'm going to take a medication that lowers my cholesterol and gets rid of my sex drive. Now, you're already depressed because you got rid of the progesterone, so then they put you on Paxil and SSRI, which actually increases people, or causes 70% of people will end up more depressed on SSRIs because it's not a serotonin problem, which now WebMD admits. But Paxil gets rid of your sex drive, which is why they treat sex offenders with antidepressants. So then you ain't got a sex drive, and you lower testosterone, so you definitely don't have any sex drive. And then you're not happy, but your cholesterol's lower, right? So then with your estrogen, same thing. Estrone and estriol protect you from estrogenic damage from synthetic estradiol and things like dairy, plastic, flame retardant, all those kind of things are horribly estrogenic. So we have lots of estriol and estrone to protect us. But those are made from cholesterol. So lowering cholesterol lowers vitamin D, lowers testosterone, lowers progesterone, lowers estradiol and estrone and estriol, and lowers the anti-aging hormone. So that's pretty messed up. So that's chronic lifestyle problems at that point. That is like, now you're on 12 more drugs just because of all those side effects. But this is kind of cool. So they had a commercial, 3 commercials in a row. I swear to God this is true. The first commercial said lower cholesterol with statins. All right. The second commercial right after that said, have you been no. It said, did you know there's an epidemic of low T, low testosterone? The first commercial caused the need for the second commercial, right? The third commercial was from a law firm. Have you been taking synthetic testosterone and suffered a heart attack and stroke? Call our law firm. The first medication lowers the testosterone. We take a synthetic testosterone, which increases your risk of heart attack, and then you end up having the heart attack that you were taking the cholesterol lowering med to somehow prevent. So the proof is always in the pudding. If we say heart disease went poof like this, then if we lower cholesterol, does it go poof right back? Do we end up back to our baseline or any really lower? Because the only time we've seen heart disease lower was when we got, I think in the 1990s, when we got really good at taking the veins from your legs and sewing on to your heart. That was our big whoop-de-doo cure, right? And what's really interesting is I took biomedical engineering coursework at Yale University OC course years ago. And the professor that was teaching it was Dr. I think Mark Saltzman, and he was the one that created the new stents that wouldn't cause the heart attack or stroke. Because the old stents you put into the arteries, they push the cholesterol, or not cholesterol, they push the plaque into the tissue somewhere magically, and it opens it up. But you just did an invasive procedure, so that breaks or creates scar tissue, which then creates another kind of closing of the artery. So then people have post-CABG strokes, which is just a mess, right? So it's a whole mess. So then, or post-stent strokes. And then he created to where there was a steroid on those. So then the steroid would prevent the scar tissue, so you were less likely to have a stroke to fix the cause of the stroke. Kind of like hypertensive medicine's side effect is hypertension. So what the hell's going on here, right? So then that was kind of interesting. So I was like, oh, I'm learning from the master back then, you know. That's kind of really cool. So if we say cholesterol is the issue and we lower the cholesterol artificially, then we should get rid of heart disease or dramatically lower back to pre-cholesterol. It's just ridiculous. So first of all, it didn't happen. There was ER studies that came out and they said, you know, 70% of those that came in the emergency room for heart attack or stroke had below 200 cholesterol. So that made the news. People freaked out about that because they're like, wait. You're putting me at risk of permanent muscle wasting disease and all these horrible symptoms to lower my cholesterol, and let alone screw up all my hormones, and you're telling me I'm more likely to have a heart attack or stroke with lower cholesterol? So then the powers that be, I guess, the researchers said, whoa. Our pharmaceuticals said, all right, we were just kidding. It's not total cholesterol. We were just teasing. It's bad cholesterol, the LDLs. So you have HDLs, LDLs, VLDLs, and triglycerides. Multiply VLDL times 5 and you get triglycerides, just so you know. So then they said, well, it must be this bad cholesterol called LDL, low density lipoproteins. Well, that makes sense because, of course, God made LDLs to kill Americans, but only recently because he hates our freedom. Because guess what? They went back through those studies and they said 50% of those that had heart attacks and strokes with less than 200 cholesterol also had normal LDLs. So the numbers did not pan out at all, but really what it showed was literally you are more likely to have a heart attack or stroke with artificially lower cholesterol. And there's a great little chart that shows higher cholesterol, lower heart attacks. Lower cholesterol, higher heart attacks. If we artificially lower your cholesterol, you are at a greater risk of heart attack. And we'll talk about that when we talk about the side effects. So one, did anybody deal with the inflammatory part that causes heart disease? Absolutely not. But we probably cause more harm. So we're not fixing a problem at this point, we're causing more harm. So when we look at LDLs, low density lipoproteins, HDLs, wonderful. Everybody loves the HDLs. They don't tell you there's 3 HDLs though. And 2 aren't as protective as one of them. So if you do like a VAP or a lipoprotein fractionation test, which are I think we charge like $50 for those, but it breaks down all this for you, right? And that HDL, it'll tell you if you have the protective ones or not the protective ones, which is great. That's great, right? You should have a greater than 55. If you have up like 80, that's awesome, right? Most people are horrible on that because there's no pill for HDLs. That's purely lifestyle. Movement, purposeful movement, exercise, and healthy fats. But LDLs, you actually can break those apart through the lipoprotein fractionation and you get a different lab report. And there's two types of LDLs. There's a large fluffy one which protects the heart just like HDLs. So you could have high LDLs and actually be more cardioprotective, which makes sense for countries that have higher LDLs and fewer heart attacks. But what about the small LDL? Now the small LDL, which is the B pattern, that actually is repairing the heart. If you were going to say one of those was bad, you say it's that, but it's not bad. He's doing his job. The real question is, what the hell are you doing to cause so much cardiovascular inflammation that you need tons of repair jobs to the cardiovascular system? So again, it's a total distraction. What's really causing heart disease? It's not the LDLs. It's not even the B patterns. They're doing their job because you're causing chronic inflammatory processes. So, we'll talk about that. But even the LPA, the ApoB100, all those inflammatory ones that like we get crazy about in my field are like, well, let's do all these extra tests. Those are turned on. Even the ApoE4, that's turned on genetically because of inflammation. So if you're causing a bunch of inflammation, that should switch on. You should have the inflammatory process. So when we do those labs, a lot of times we're just taking a snapshot to go, yeah, you're pretty inflamed. Like, what are you going to do about it, right? But if you look at what reverses those, it goes back to very, very basic food. Eating inflammatory reactions gives you inflammatory reactions. Eating anti-inflammatory reactions reverses inflammatory reactions. So we said if you eat corn-fed fish, chicken, fish, or if you eat a bunch of corn-created products, from candy bars to chips to sodas, that's the same inflammation. And most Americans have 40 times the inflammatory omega-6s to the anti-inflammatory omega-3s. So we're 40 times more likely to be arrhythmia, heart attack, stroke, hypertension, and chronic pain and inflammation. And that's us. That's America. 3 out of 4 chronic inflammatory conditions, 1 out of 2 for heart disease. That's totally us. It's not a mystery. It's not a myth. What the hell is going on? So, what about this number? So, cholesterol, if you don't know, so years ago I created the world's largest age and gender specific database, and we created a laboratory analysis out of that. The most amazing thing happened when I did that research. I found out way more about how messed up labs are. And most lab ranges are really just reference ranges for what we see. So we're one of the sickest, fattest, dumbest populations, and then they say, hey, every few years, this is kind of what we're seeing as the reference range, or what a lot of doctors will call normal. But it's not normal. It's horribly unhealthy ranges for most people. So if you look at like thyroid, that TSH might be 0.4 to 6. But 1 to 2, closest to 2, is really kind of your optimal range. T3 free, it can be 2.2 to 4.2, but really over 3 is where we see people are optimally functioning. So what we expect from a dumb, sick, fat population versus what we really want to see for the healthiest, happiest, and balanced, totally two different things. But when you look at cholesterol, for years, cholesterol normal could be up to 300 with less heart disease. We had doctors telling patients that if your cholesterol was 200, 300, oh, you're doing great. And then 1 year, it all changed. In 1 year, people came and got the same damn labs, had the same damn numbers. But now their doctor was like, holy crap, you're going to die. Yeah, we got to shut this cholesterol off, right? But what the hell happened? They came up with this number of 200. Who came up with the number? 8 doctors who were financially tied to a new company that was going to come out with a new drug called Lipitor that was going to lower cholesterol below 200. So the number wasn't based on science. It wasn't based on best practices. We didn't go to other countries and say, okay, you guys have 70% less heart disease. What's your numbers look like, right? We just created an artificial normal from profiteers. That's probably not the way we should be doing this. So, if we look at that, then what's the real cause? So we'll jump to the numbers made up. You're more likely to have heart attacks if you lower it. So let's take a kind of jump over and say what causes heart disease. And what's funny is we'll start with hypertension. I want to talk about hypertension real quick because years ago when I was like 20 something, this is so messed up. I had a Porsche, and I would drive that thing like a bat out of hell. And on the way to the doctor's office for a physical, I'm like in the middle lane, and then there's a semi, and then there's another lane, and I just zip over 3 lanes, and then I'm going to go past that semi, and all of a sudden that lane ended, and I just hit all these cones, swerved back into the lane behind the semi, and just felt like, holy crap, I'm going to die, right? So then I get off that exit, the next exit, go to my doctor's office. They take my blood pressure. It's really high. That doctor said, Patrick, you have hypertension. And I was like, that's crazy. Like, I didn't even put it together that maybe we shouldn't take it off based on me having an almost wreck, But I didn't know that. But I do remember saying, well, and you're not supposed to do it off 1. You're supposed to do it off, I think, at 3 within 6 weeks. And for pain, no situational stuff should be causing you to have stress and high blood pressure. Totally not how you're supposed to do it. That's why 52% of all diagnosis treatment in the U.S. is incorrect, according to the New England Journal of Medicine. We don't really do what we're supposed to be doing sometimes. So, misdiagnosis for sure. But when you look at I asked him, I said, so why do I have hypertension, right? And he goes, Patrick, 95% of the time we just don't know. And I remember even in my 20s thinking, pretty sure you should know, right? You're a doctor, you went to doctor school. And so I really believed that. I thought, oh my God, how can one of the biggest killers be this giant mystery? And then one day in cardiovascular physiology class, I opened my big-ass textbook on hypertension, and there was a chart. And it showed exactly what causes cardiovascular constriction, and it's all lifestyle stuff. So if you don't deal with lifestyle, you don't deal with diet, then who cares what makes your blood pressure high? 95% of the time, it's what you're doing. 5% it's post-kidney disease from diabetics. So sympathetic nerves will cause that. You can actually have your back out of place, and it'll trigger a nerve called the sympathetic nerve to your heart, and then it'll increase your blood pressure and even your pulse. Norepinephrine, epinephrine, so that fight or flight, the chronic stressful lifestyles that we have. But also if you get your blood sugar over 185, you will start peeing that stuff out. You will drop it too low from too much insulin, and then you actually produce norepinephrine, epinephrine, cortisol to raise blood sugar without more sugar. So every single hyperglycemic meal that we eat or every soda should cause us to chronically have hypertension as a result. Of course, the antidiuretic hormone, that'll constrict blood vessels. But beer, black tea, coffee, chocolate, those are diuretics. So they will make us pee out more than we want, and then we constrict, and the average American is subclinically dehydrated pretty much their whole life. So much so that women between 20 and 40 will shrink about 2 to 4 inches just due to subclinical dehydration. Bones aren't shrinking, fluid spaces are shrinking. And then endothelians are the biggest problem with this, and that is all those chemical toxicities, inflammatory foods, all those things that we don't even look at as doctors. For the most doctors don't even look at when it comes to things like hypertension or cardiovascular disease. Now we see some comments here. So Stephanie, she says sugar is mostly in everything and how to avoid it. So that's good. There's 50 different names for sugar. That's the hard thing. Maltodextrin you'll see in lots of stuff, and that's sugar plus sugar plus sugar, so like triple sugar. So I always give the example, if you look at Cheetos, it has sugar on the label once, but it has 7 other names that become sugar. So Stephanie, the easiest way with sugar is really to eat as much of fruits and vegetables, nuts, seeds, berry, legumes, greens, and control your food as much as you can. Now, this is not fruit sugar. Juice is sugar with vitamins. Juice is a problem. But really, we're talking about added sugar to the diet. So even people switch to coconut sugar, monk sugar, still too much sugar, still causing cardiovascular disease. So as much as you can, eating real, actual food is going to be your main way. People switch to stevia. Stevia will make you fatter than if you ate the damn sugar. Less than diet, which is aspartame. But if you stop eating sugar, your tongue will desensitize to sugar, and then you'll notice that things taste overly sweet when they didn't before. So you'll resensitize to flavor, and that's really what we want is flavor. And then Melissa says, it's fascinating. It is. It's crazy. It's absolutely crazy. So I'm glad that the comments are showing. So if you guys have more comments, please. Now, one of the things that we want to look at is the actual causes here. So if lowering cholesterol does not lower heart disease, it actually increases heart disease, then what the hell really causes this? And so when we look at this from kind of medical, functional medicine, clinical nutrition, lifestyle kind of aspect, we notice that it's not why do we have heart disease, it's absolutely we should have heart disease. Now, first thing is, with cardiovascular, you need lots of omega-3s, right? So the Mediterranean diet, the Costa Rica diet, the Okinawa diet, all these diets that you read about, they do lots of fish in those diets and lots of fruits and vegetables because they're high in omega-3. Now, America is really high omega-6, so we don't get enough 3s. So then, if your heart runs off 3s, but you feed it 6s, then you have irregular heartbeats, and then you have heart attacks and strokes from that. But you also end up with other cardiovascular disease problems from this. So omega-3s are eating fish. But what do fish eat to get the omega-3s? Plants. So it goes back to eat fruits, vegetables, nuts, seeds, berry, legumes, and greens. And then you're going to get plenty of omega-3s. Now, if you eat corn-fed meat, corn-fed chicken, corn-fed pigs, right, cows, that's going to be high omega-6. So that type of meat that you buy for you and your family can help determine whether you have heart disease or not heart disease. The second thing is high insulin. Now, high insulin goes along with high triglycerides and high blood sugars. So high insulin is because we eat 150 pounds of added sugar to our diet. That causes everything to decay within the cardiovascular system, and then you lose fingers, toes, and all that, right? So high insulin is due to high blood sugar. And then high blood sugar converting to fat means high triglycerides. So triglycerides on that cholesterol panel actually have something to do with this. And that's really just stop being a sugar junkie. And that's what we do a lot with patients. But Really, most people are consuming sugar as drugs because life isn't good. So if you change that, then all of a sudden you don't need sugar to cope anymore. It's kind of like looking down on people like, oh, well, you smoke crack or you do heroin. Well, they don't do it because they want all the side effects and problems. They do it because it's a matter of coping. So the rest of us that are condemning them are eating sugar, wheat, and dairy, which are all morphine and crack. So it's just natural. We're not shamed for that. But that sugar problem is a huge problem for most Americans. And it's just addiction. And once you create hormonal balance, you can create to where people can be healthy and happy, then suddenly you don't need sugar to cope anymore. Like, it's real easy making those hard choices for happiness, right? Now, low vitamin D, because we take statins, and that lowers our cholesterol, which makes vitamin D. But also, we tell people the sun causes cancer, which again is this kind of misdirection where we say God created the sun to kill mostly Americans, but only recently because he hates our freedom. Because in the 1930s, from Adam and Eve to the 1930s, really hard to get some skin cancer. And then in the 1930s, we put benzene into lotion to absorb UV rays to lower the cancer from here to here, right? Benzene, the flammable part of gasoline, the stuff we use to cause cancer, the stuff in my textbook of anemia in practice that says causes blood cancers like leukemia, we put in lotion to prevent skin cancer, and guess what happened to skin cancer? It doubled. And then we said, well, we got to be more aggressive with it, and we got to put even a more aggressive benzene in there called PABA, which is now banned because it causes too much cancer, and then cancer quadrupled. And then we use oxybenzone, which is the most potent benzene we have from gasoline, and of course cancer goes through the roof, and then again we blame cancer on the sun. The sun's always been here, and then all of a sudden, cancer. But it only started becoming an epidemic when we put a cancer-causing chemical in the lotion. So we scare the hell out of people, but of course near the equator where the sun's the most intense, not much skin cancer, right? Countries that are next to each other that have the same sun trajectory, their cancer rates are wildly different. And it tends to end up where you put cancer-causing chemicals on your skin, you get high rates of skin cancer. So we scare the hell out of people, so then they don't go in the sun, and then they don't get vitamin D, and we scare them about heart disease, and then they take statins, and that lowers their vitamin D, and that puts them at a real, actual risk for heart attack and stroke. High homocysteine. Now, I love homocysteine. I'm just saying that. It's part of the research I do on progenomic psychiatry, and with homocysteine, that is through the homocysteine cycle, which is regulated, those homocysteine by 50% by B12, so methyl B12, 50% by B6. So S-acetylhomocysteine through B6 becomes glutathione, and it prevents liver damage. That homocysteine that's left gets converted to methionine through B12. And then that goes to the folate pathway, and then that regulates methyl tetrahydrofolate and all that. So, with high homocysteine, that is because we don't eat beans and greens and fermented foods as Americans. So if you don't eat those things, and you don't drink fermented things and eat fermented things and use fermented sauces, then you don't get enough B vitamins, and then you have high homocysteine, and then you literally start damaging the arteries, and then you increase LDL-Bs, and they start repairing that, and then you have a higher cholesterol, and then your doctor says you're gonna die. Lower the cholesterol. Now, low testosterone. What is causing the low testosterone? The statins that are lowering the cholesterol, because cholesterol makes testosterone. Now, we see, like Silent Spring, we know that male fertility from 1960 to 1990 goes like that. like just absolutely just getting rid of testosterone, let alone that drug doing it, right? Now, the next reason is a little different. So it's high estrogen. So we're taking a medication to lower testosterone, lower vitamin D. It should also lower estrogen. However, we're getting copious amounts of exogenous estrogens, synthetic estradiols, or xenoestrogens, from pesticides, herbicides, fungicides, plastic, bisphenol A linings of cans, perfumes, colognes, artificial scents, styrofoam, and even dairy. Dairy has, you need this much, dairy has that much. So all the dairy, all of the birth control, all the hormone replacement therapy, all those synthetic chemicals that we put on our body dramatically increase the estradiol, thus creating estrogenic changes, which breast cancer, uterine cancer, ovarian cancer, infertility, PCOS, fibroids, all that kind of stuff, and endometriosis, and of course it actually kills the heart. So even like the Women's Health Initiative in 2005, it was shut down by the scientists because they said it was unethical to document what was happening to women that they were giving synthetic estradiol to. And they said it increases the risk of heart disease up to 87% in the first year and increases female cancers up to 30%. So now women who never really had heart attacks actually are beating men. And that's why. Because it's a direct cause. But men are also getting all this estradiol, and that's why we have prostate problems, and we have man boobs, and men are lactating. 1 out of 1,000 men are getting 1 out of 1,000 breast cancers are now dudes, because your body doesn't care. If you poison it the same way, you're going to get the same problem. Low nitrous oxide? Well, that's because we didn't take enough arginine supplements. But arginine is in pretty much every food. So studies show that when the sun hits your skin, it releases the nitrous oxide, dilates your blood vessels, lowers blood pressure, puts less pressure on the heart. Over time, that prevents heart disease. Wonderful. But we can't go outside because of the sun. So then inflammation overall, because we talked about 40 to 1 inflammatory reactions by the American diet. Low HDLs. And like before, we said HDLs are lifestyle. Movement. So most people are purposeful movement. If you overeat, then you got to do exercise. And then healthy nuts and seeds. So we don't do that, and we're not going to move, so screw it. The average European walks 10,000 steps, the average New Yorker 5,000, average Kansan 2,500. So HDLs are a direct reflection of your lifestyle and diet. There's no medication for that. So that's what is an antioxidant, to undo all the damage from all the oxidative damage from all the sugar and black tea and all those things. So then we have oxidized LDLs. Now, oxidized LDLs we see in plaquing. So then they say, oh, that must be cholesterol. But again, LDLs are not cholesterol. They're low density lipoproteins. They're not cholesterol. They're carrier molecules. But when they're oxidized, they're damaged. Oxidized are from not eating enough antioxidants, which are fruits and vegetables, nuts and seeds, berry, legumes, and greens. Anything that's brightly colored is full of lots of antioxidants. Anything that decays very quickly, lots of antioxidants. So we want to consume lots and lots of antioxidants, but the average American eats 1 fruit or vegetable a day. And that vegetable is potatoes in the form of French fries, potato chips, which is fried, so that's out. And juice, fruits, just really juice, which is back to the sugar with some vitamins in there. That's not helping anything. So one of the greatest reverses of heart disease is just fruits and vegetables, right? Even the Swedish studies, when I give this lecture on heart disease, Swedish study was fruits and vegetables. The Chinese study from Zhejiang University was green tea, which is antioxidant. Black tea, oxidation, heart disease, joint pain. Green tea, antioxidant, I changed my genetics. It's really good. And there was the Harvard study, and it was like red wine, onions, garlic, and nuts. So fruits, vegetables, nuts, seed, berries, legumes, greens. That's what reverses heart disease. Antioxidants. High triglycerides, we said, was high blood sugar. Same with high insulin. That's just our diet. But low vitamin E. Low vitamin E. Now, what's funny is my good friend Dr. Paul Frank, he sent me over video that I watched, and he's a nerd like me, and so, explained kind of how we came to vitamin E. So vitamin E is like bran oil, but the synthetic vitamin E that we typically get, it's just petroleum. It's like a 1/8 petroleum-derived vitamin E, like alpha tocopherol. It's not the same. And then you also have D-L-tocopherol, which is synthetic vitamin E that rotates both ways on the axis, which doesn't occur in nature, increases your risk of heart disease. You can literally take some cheap-ass vitamin E or some Equate or some one-a-days, and they literally are increasing your risk of heart disease and cancer. But if you eat vitamin E, it's all good. You reverse cancer. You reverse heart disease. So vitamin O. It's not vitamin E. That's our major one. It's vitamin K. Vitamin K. So vitamin E is important for this, but really that's more of your antioxidant thing. So scrap that. Vitamin K. Vitamin K is what helps with clotting, and prevent clotting. So a lot of times we'll tell you not to eat anything green if you're on warfarin, but really they should be eating regular greens and then basing the warfarin dosage off that. But that's not how they do it. Low vitamin K is because we don't eat greens at all. So Americans aren't eating fruit, they're not eating vegetables, they're not eating greens, they're not eating wild-caught fish. They're just eating a bunch of dairy and sugar. So, low vitamin K, not eating greens. And not head lettuce green, right? We want dark, rich greens, some of that kale and kohlrabi, and even romaine lettuce would be good, or the spring organic mixes. Like, you have to get too crazy with those. Spinach is the easy one. And then if you make green smoothies, you're getting all this stuff in the perfect amount to reverse heart disease. And then high fibrinogen, and that's caused by, so that's what's going to clot. So the low omega-3s, the low antioxidants, the high inflammation, the low vitamin K, that's all going to contribute to more clotting. And then high blood pressure, which we just said was dehydration and stress, your back actually being out of place can trigger that through the sympathetic nerve ganglion. And then endothelians from inflammatory kind of toxic lifestyle. So when you look at that, all those are lifestyle. Your doctor probably doesn't talk about all those things with you, right? But that is how you actually cause heart disease. That is actually how you reverse heart disease. When we talk about hypertension, we know what causes it. We know exactly how to stop causing it. And the whole goal of what I do in my practice is functional lifestyle medicine. And when you practice that way, life becomes very, very simple. The most complex diseases become very simple. How does it work normally? What are you doing to cause it? Stop causing it. You are the greatest person to reverse your own heart disease or to prevent it for everybody else's. And we got a couple more things here. So Lane, she says, sugar has been one of the hardest things to cut out for me. That's because it's crack. Mainly because of my love for sweet tea. Sweet tea. Sweet tea. I'm from Texas, the home of sweet tea. Right? No, that's not even the right accent. I'm messing it all up. Y'all want some sweet tea? So, yeah, so don't drink it. It's poison. It's killing you, right? It's ruining your hormones. So people are like, I love sweet tea. Well, sweet tea doesn't love you. Sweet tea stole your credit cards and banged your sister, right? Sweet tea is not a good relationship. So you can love sweet tea, but not drink sweet tea, right? Love it from afar. Oh my gosh, sweet tea is so cute, but nope, right? And then Melissa says, canned vegetables aren't great for you because of the can. Yeah. So here's the crazy thing. So We're almost running out of time here, but Yale University did this study where they talked about bisphenol A or BPA actually causes neurological problems in children and adults, right? So learning disorders, behavioral problems, ADD, all the same things that we see with synthetic colors too, right? We know yellow food coloring decreases brain growth by 3,000%, blue by 5,000%, MSG by 8,000%, but that plastic in there was the problem too. We know Harvard says that moms that touch receipts at Walmart and Dillon's, right? There's enough bisphenol A on that thermal receipt to cause anal genital malformation in the developing fetus if she touches it at the right stage of development. So this is some pretty messed up stuff. But that BPA that's in cans, it's in almost all canned goods, from your Twisted Tea to your beer to your Truly to White Claw to soda to even like Perrier, Evian cans. All those cans are lined with estrogenic, neurologically toxic, heart disease causing plastic. There's a great little video where they took a can of soda and they dipped it in this chemical, caustic chemical, and it dissolved all the aluminum, and there's just a plastic bag there, right? We don't think about that. But yeah, Melissa, that's a huge problem. So you can get BPA free, but that's usually BPS because the can's toxic. So, real vegetables, and probably your better ones, flash frozen. So typically if they're too ripe, they'll freeze them, or they'll make them a sauce. So and put them in a jar. So I try to buy stuff that's fresh as much as I can, organic when I can. But really within all this, when you talk about eat real food, is what am I doing now? What could I do better? What's best and what's optimal? Optimal might not be available or cost effective for you. You just want to make progress over perfection in the beginning. And as you get to the next step, it's easier to go to the next step. It's easier to go to the next one. It's easier to go to the next one. And then eventually, you are taking this much toxicity and making it this much. You're taking this much nutrition and making it that much. And then your whole lifestyle then creates balance and happiness, and like, it's amazing. It is amazing to watch these patients go from no hope, their whole life crumbling. They got 60 chronic conditions that are going on at the same time. They can't poop, they can't think, they can't sleep. Like, they're bloated all the time. Like, they're a mess. And then 6 weeks later, most everything's kind of working. And then a few months later, they're like, wow, I can't believe this. But it doesn't take too much to really create a huge amount of change. And when we're talking about 1 out of every 2 people, and women are more likely, that's your family. That's your church. That's your community. When we're talking about heart disease seen in 5 and 10-year-olds, when we're seeing 20-year-olds have heart attacks and strokes, this is your family. This is people you know. And really the everything we need to know to reverse heart disease is already here. It's just the will to apply it. And probably the other biggest thing is don't get caught up in all the gimmicks and nonsense. Now, real quickly, I want to address one more thing. So when we talk about statins are medications. Medications are upregulators or downregulators, right? So they block something. So this blocks a pathway up here, but all the other functions down here are stopped also to get to that cholesterol. And those pathways are things like dolicol, TAU, selenoprotein, CoQ10, major pathways. So if you disrupt the glial pathway, you get senility, amnesia, confusion, disorientation, brain fog, which is probably the most common symptom we see these days. We're worried about the permanent muscle wasting disease, but most people can't function anymore. The dolicol pathway is how your brain communicates. So you end up with this what's called neuropeptide dysfunction, which then prevents brain tissue from signaling to other brain tissue, and globally you start losing everything. Everything in your brain slows down because of the statin blocking that pathway. If you look at the TAU pathway, this is the worst. If you block this pathway, your nerves are made with cholesterol. You end up with ALS, Lou Gehrig's disease, anterolateral sclerosing, and you lose motor function until you die. Because you need that cholesterol to make the covering of those nerves. It actually can cause Alzheimerism, dementia, muscle atrophy, Parkinson's. So now mom can't get up the stairs anymore. Now I can't stand too long. Now I start having tremors because all the neurological function requires cholesterol and cholesterol coverings. But when you get to selenoprotein, sure, you end up with neuropathology, a bunch of nerve pain, numbness, muscle pain. But that's not your greatest concern. The greatest disruptor is that CoQ10, because CoQ10 is how every single cell creates energy and uses energy. So all of a sudden, you have chronic fatigue syndrome, congestive heart disease. To prevent the heart disease, you lower the cholesterol, and now you have congestive heart disease? And that's a hard one to come back from. Shortness of breath, fluid retention, now you get edema in your legs and your eyes and your face. Next thing you know, you get mitochondrial dysfunction, which, functional medicine doctors love that one. But if you're just causing it, that's the problem. And then, of course, it causes diabetes because you just slowed down their metabolism in a country where they eat 150 pounds of added sugar, and 1 out of 2 people is either already diabetic or is about to be within 3 to 5 years. They gain weight like crazy because you just slowed their body down. And then you get the permanent muscle wasting disease. You do not get those muscles back with statins at all. And then, of course, the neuropathies. So now I can't feel my toes, my muscles wasted away, and I'm still at a greater risk of a heart attack or stroke. We're doing this wrong. We are. Now, I'm not telling you to stop your medication. You always have to take it based on the prescriber. But there are different paths you can assume or go through that give you a higher quality of life and statistically lower risk of heart attack and stroke. Either cholesterol hates Americans because of freedom, or we're doing this wrong. We're not addressing the true actual causes. We're not addressing all the lifestyle factors that create heart disease. We're resorting to a quick fix that actually makes your life substantially worse. Acid blockers and statins have the highest risk warning for the Iowa pharmacopoeia for long-term use. It's not worth it. So, that's my opinion. I'm not telling you not to take it. You can do what you want. But I hope this really helps y'all. I know I get lots and lots of questions about this all the time. I know we've done a couple shows over the last 5 years on this. But it's always good as a little refresher. And we did a little different this time. So, love you guys. I'm so glad to have the show back. I'm glad I figured out the mic situation. Which, again, it wasn't through the iPhone fix or through Facebook Live. I just went through the computer instead, so I bypassed it. So thanks for y'all's questions. If you have more, please post those. If you want to buy my cookbook, it's on Amazon, Dr. G, Cooking After Dark with Dr. G Gourmet Tacos, and they are phenomenal. So a lot of people are just all the time like, oh, tell me how you make your tacos, all that stuff. So I made a book of it. And we're going to come out with a new cookbook this year that's going to have all kinds of other food in there as opposed to just tacos. So, all right, you guys. Thank you for joining. I really appreciate it, you guys being here. And please share this with your friends and family. Hopefully, a lot of times we can just plant seeds and at least help people start kind of changing decisions and finding things that are a better fit for them. So, see you guys next Tuesday. And I think I'm going to brave it out, and we're going to talk about COVID and the immunization and all that. So it'll be a really interesting one. So, all right. Bye, you guys. Appreciate it.